Analysis of short-term outcomes of totally extraperitoneal and extended totally extraperitoneal repair of ventral hernia. This important article is authored by the following scientists. Ventral hernias of the abdomen are defined as a non-inguinal, non-hiatal defect in the fascia of the abdominal wall. Annually, there are about 350,000 ventral hernia operations. Its repair is one of the most common surgical procedures performed by surgeons worldwide. Since the beginning of surgical history, treatment of hernia has evolved through different stages. The technique of e-TEP can also be applied for ventral hernia repair in 2017. The retromuscular e-TEP ERS approach combines the advantages of the Sublay position of the mesh along with the benefits of the minimal invasiveness of the procedure. A prospective observational study was conducted among 60 patients with non-complicated ventral hernia who were randomized into two equal groups, equally, who were further subjected to either TEP or e-TEP laparoscopic ventral hernia repair. Patients posted for surgery received similar perioperative management. In the entire study, the p-values less than 0.05 are statistically significant. The data was analyzed using the Statistical Package for social sciences. Distribution of median duration of surgery among the cases studied was significantly higher in the laparoscopic e-TEP repair group as compared to the laparoscopic TEP repair group. e-TEP has an advantage over TEP owing to the less steep learning curve, with a wider angle view, a greater degree of movements for instruments, and ergonomically better operative experience. In conclusion, laparoscopic e-TEP hernia repair is the better modality of treatment for uncomplicated reducible ventral hernias in terms of wider working space, lower conversion rates, and lenient learning curve. Introduction. A hernia happens when a weak spot in the abdominal wall allows organs or tissues to push through, often causing pain or discomfort. One common type is a ventral hernia, which appears on the front of the abdomen and can be either naturally occurring or caused by previous surgery, called an incisional hernia. Around 20 million people are treated for hernias every year, and ventral hernia repair is a common surgery worldwide. There are two main ways to repair ventral hernias: open surgery or minimally invasive, laparoscopic, surgery. The newer laparoscopic techniques, especially TEP, totally extraperitoneal, and e-TEP, extended view TEP, allow surgeons to fix the hernia without entering the abdominal cavity, leading to fewer complications and faster recovery. These advanced techniques place a mesh behind the abdominal wall to strengthen it, but they require special skills and longer surgery times. Despite these advancements, there is still no single best method that fully prevents complications like infection, recurrence, or pain. Understanding the anatomy and blood supply of the abdominal wall is crucial for successful surgery. As surgical methods continue to evolve, better training and technique development are essential to improve patient outcomes. Conclusion. Laparoscopic surgery is a modern technique used to repair ventral hernias with smaller cuts and faster recovery. There are two main approaches, TEP and e-TEP. In this study, we found that the e-TEP method is easier for surgeons to learn and more comfortable to perform than TEP. It gives more space to work, allows flexible placement of surgical tools, and has fewer chances of needing to switch to open surgery. Although both methods are safe, e-TEP had a slightly better outcome, especially for simple and reducible hernias. The learning process for TEP is longer and more challenging, but with experience, surgeons become more skilled. Overall, e-TEP is a better choice for treating uncomplicated ventral hernias due to its technical ease and lower risk of complications. Surgeons must continue learning and adapting to new techniques to offer the best care for their patients. Thank you for watching this video. Please subscribe to our channel BP International to watch more videos in the fields of science, technology and medicine.